I'm Dr. Penmetsa, and my specialty is cardiology. I went to, my training has been in the Midwest, in Chicago and Indianapolis, during my internship and residency. And then subsequently I did my fellowship in cardiology in Indianapolis. And then I've been in a faculty position for a year in Indianapolis, and subsequently I decided to go into private practice, and I've been essentially down south. My first practice was in New Orleans, Louisiana, and subsequently I've been in the state of South Carolina. A cardiologist is somebody who, as the name suggests, takes care of problems of the heart, and they can really be divided into three different subspecialties in a sense, which would be blockages in the heart, or what we call as coronary artery disease, followed by congestive heart failure with or without weakness in the heart muscle and fluid buildup in the body. And lastly, heart rhythm problems, the most common of which is what we call as atrial fibrillation. I had a lot of good mentors. The reason I actually became a doctor in the first place is I was quite young when I became a doctor, and I was influenced by family members. A lot of them are physicians, surgeons, even cardiologists. So that's what led me to the field. Usually I try to be not as much as a doctor to them, but more of a friend who can give them advice, and try to lead somewhat by example, and try to tell them what any diagnosis means, what the potential treatments are, what are the upsides and downsides of treatment, so they can collectively, along with me, make a decision as to how they want to proceed with their medical care. My interests really, outside of medicine, really lie in, because of the time constraints, if possible, travel outside of the U.S. and also reading books, which is mainly I have a keen interest in history and philosophy. So those are the books I would usually tend to read. To make an appointment with me, please ask your primary care provider to make a referral to me.